Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series of where we highlight some of our amazing PA members and how they work in their respective fields and utilize telemedicine. My intention is that this serve as an opportunity for us to connect and network together and also to highlight our amazing members. You know I believe that we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. Thank you so much for joining us again. Today I have another wonderful PA that I want to introduce you to. Her name is Shama and she is a ENT PA who also utilizes telemedicine in her practice. Hi Shama, how are you?
Hi, Hannah. Thank you for having me.
Absolutely, thank you for joining us today. Can you start off by stating your name, how long you've been a PA for, the area of medicine you practice in, and how you utilize telemedicine in your field?
So, my name is Shama, and I am an ENT PA. I've been a PA for 7 years now. The first 5 years, I did general ENT and sleep medicine combined. And then for the past 2 years, I've been doing solely general medicine. So, I first, was introduced to telehealth when COVID hit. And, I can't really imagine ENT PAs or even ENTs doing telehealth, but during COVID, it was a huge necessity. And so, we were waiting for the insurance companies to approve all of the providers to do telehealth. And as soon as that was approved, we switched completely to telehealth. And then we did that for a while, and it was very helpful as a screening tool, especially because our practice had decided that we will not see any COVID related patients in our office because we're not equipped to diagnose COVID, and we didn't have any COVID testing. And then we were also not equipped to treat COVID. So any kind of COVID related symptoms, they overlap a lot with ENT symptoms. And so we had to really weed it out very well also to protect our staff and to protect other patients coming into the office. And so, telehealth was really helpful with that, so that we got to know what the patient, what their symptoms were, what they were seeking, and then whether it was safe enough for them to come into the office to see us or not. Now, luckily, with proper PPE and the vaccine, we're back to seeing most patients in the office again, but it's still been a really great tool for, you know, as a screening tool for patients, and also as a follow-up method for patients who are still a little weary of coming into the office.
Absolutely. So it started off as a necessity with the whole pandemic, and then now you're still utilizing it in some, way to help it, like you said, to do the screening, but also to follow up. Any other uses that you've been able to do with telemedicine, particularly in ENT?
So like I said, initially for screening, especially if it's like throat or nose related symptoms, we felt pretty safe for allowing like ear complaints to come into the office. And then again, for patients who need to follow up with us, but I don't necessarily need to examine them in the office. I can just follow up and say, okay, I prescribed X medication for this much time. Is it helping you? What are your symptoms now? And a physical exam is not really necessary. So it's just been a great tool.
All right. What do you like about telemedicine, and what do you find to be a challenge, please?
So there are pros and cons to telemedicine. The pros are that it has made healthcare more accessible to a certain group of people. It's made healthcare accessible to people who are very busy and can't take time off of work. And so they're able to fit in a quick 10, 15-minute health visit in between work or at their lunch break. It's great for people who are parents and have kids at home and don't have someone to watch their kids, so then they can just quickly lock their door and seek healthcare. It's great for people who don't have any access to transportation, or people in rural areas who don't have access to a lot of doctors or healthcare providers, so they can really get appointments a lot easier. And so those are some of the pros that I really liked of telemedicine. The cons that I would say is that it was also a little bit of a barrier to another population, more so people who are a little bit more, technology challenged, the elderly population who don't know how to turn on, don't know how to connect or use a computer. There were a lot of issues connecting to some patients, and it would take up the entire visit with the patient trying to figure out how to turn on the audio, how to turn on the video. And then luckily, insurance companies were also reimbursing for telephone visits. So I would just switch it over to having a telephone visit. But, patients who also English is not their first language, so it's a little bit more difficult to get an interpreter or just for them to understand the email and how to log in to the telehealth visit. And the other thing that was a little bit, telehealth is a little bit more limiting because you can't do the physical exam. And so, there are some complaints that are just very clear cut, like that's, I know what it is. But then there are others that leave me wishing that, okay, I really wish I could look into their ear, or I really wish that I could narrow down the list and see what's going on.
Absolutely. Thank you for sharing that. One more question for you, please. If you could share with us a clinical pearl, a words of wisdom, something with our fellow PA students who are watching, along with our fellow PAs that may be, what would that be, please?
So I have a few tips on ENT related questions that you can ask that can help you if you are doing telehealth and you're trying to figure out certain ENT symptoms. Number one, for ear pain. And a lot of times ear pain can be, you have to differentiate between whether it's an ear infection, or a lot of times it can be TMJ pain. And so if you ask the right questions without being able to look inside the ear, sometimes you can separate the two. So, when the patient is explaining their pain, you can ask them to describe the pain. If it's a sharp shooting pain rather than an aching pain, it tends to be more TMJ related. Also ask if they are having any clogged ears or decreased hearing. If there is decreased hearing, then it's more likely an ear infection and not TMJ. Another question that I use to differentiate the two is I ask if it's one-sided ear pain, or does it sometimes alternate from side to side? If it alternates from side to side, that's more likely TMJ. And then another question that I ask is the pain, is it just deep inside your ear, or does it radiate? Often TMJ can radiate down to the jaw, behind the ear, up to the temple area. And so it's, sometimes an ear infection can also radiate a little bit around, but textbook TMJ, it radiates down to the jaw. So that's how I can tell the difference between TMJ and an ear infection. And then even under ear infections, you need to know if it's bacterial ear infection or fungal, because sometimes it's fungal and then you prescribe an antibiotic eardrop and then it's not getting better. So you have to watch out for patients who have a history of diabetes or they're immunocompromised. And then another clue is that severe itching can clue you into that it's maybe a fungal ear infection. So you'll have to prescribe antifungals instead of an antibiotic eardrop.
Those are some great pearls. Thank you so much for sharing that. Thank you so much for joining us today, and thanks everyone for tuning in. We'll connect with you soon. Take care, everyone. Bye.